So I want to ask you, why do you think that it's so important for people to educate themselves and care about prevention instead of just wait till getting sick?
Yeah, a very good question. And I think this is an old saying that prevention is better than cure. And I believe it applies for most of the medical conditions. And why it is important? Primarily because you can not only prevent the disease, but its progression. And also, we have seen that it saves cost, and the outcome is much better. And it does
Yeah.
reduce hospitalization and also decreases mortality or death. And
That's true. And it's also
and
better for the healthcare system too, like because like as you said, like the hospitalization will be decreased, and it's like it's better, like it's good to invest in educating people and like telling them how is it important that they take the time, educate themselves and care about their health before they really get sick. uh, and so what do you think is, if you want to call three simple daily habits that people can start it today for their heart health and their overall health?
sure. So first and foremost is being aware of heart disease and accepting and adopting that health, heart health is important. Second, I would say that they should engage in a good lifestyle, which includes a good dietary habit and regular physical exercises. And third, which is most important, is getting their heart checked on time. So this is a cardiac screening program, which I believe is very, very important.
So, what if I ask you what kind of diet or the lifestyle you recommend for heart health? Like, what is your number one going to?
Yeah, diet obviously is most important. It is more important than exercise. And as you may have heard, that it is 80%, 20%. So
Yeah,
diet is, people have to focus. And that's where the major or the majority of the benefit is will come from. And then it is, of course, exercise. But we must not forget two other things which are important in lifestyle change. One is sleep, and obviously to sleep well you have to have less stress, so you can combine these two, and then use of tobacco or smoking. So these are important lifestyle changes one should adopt to have a healthy
that's
heart.
true. And is there any specific kind of diet that you recommend to your patient, or it's just like overally, like, is it any specific diet, like for example, keto diet or low fat diet? Like, what do you recommend for your patient to go for? Like, what's your first recommendation for someone if they want to only focus on keeping their heart health, as a priority?
So well, see, Dr. Golsa, I see patients in my practice and they come up with a lot of funny dietary regime, I call them.
Yes, that's why I asked. Like, it's so controversial.
Yeah. And honestly speaking, I do not recommend a single diet because they do not do in a correct manner. Keto
Yeah.
diets I've seen, they have been a lot of medical problems related to keto diet. So all I tell them is to keep it simple, have a balanced, nutritious diet, reduce your calorie intake first of all, and also reduce the fat and the sugar. Eat the right amount at the right time, and also you must ensure that the diet is one part, then the drinking part is water. What is definitely important to digest the food that you have taken, and avoid alcohol, avoid excessive tea. So that I think should form a part of the dietary regime as well. But I'll just add to here, uh, some patients, they ask me what is good and what is bad. So instead of giving them a long list, I put them in a very, very simple term, that reduce or avoid eating everything that tastes good, which is tasty, and eat more which are not very tasty and not very palatable. So these are
Yeah,
probably.
but I believe like nowadays there are so many good like healthy recipes that you can have a tasty food but at the same time healthy, you know? It's just like now in the social media and all, like you can really find recipes that, and you can make it for yourself a very healthy meal and at the same time tasty too. Like,
Definitely.
people should put the time, you know, when, like, this is what I'm saying, like, when you put it as your priority and you don't want to make your diet so boring, so you need to put time, you need to educate yourself, you need to like maybe get a cookbook or like going to YouTube, see the recipes and try to make it exciting for yourself in order to stick to this and as a healthy habit, not
Right.
just like keep it for 1 month, 2 months, and then just like get back to the routine that you've been before. This is something that really can guarantee your health in the long term.
Definitely. I think maybe you have interest in cooking, and probably you may
Yeah.
answer that better. I'm, I'm
Yeah, I'm really
definitely
into this topic. Yeah, like I follow all the recipes and see like, because if you want to really make it as a daily habit, it cannot be so boring or like very, it's just like needs to be tasty. Other than
agree.
that, your brain just reject it,
Agree. I
like
agree.
you need to give your brain a good rewards.
Yeah. And also, we should not be very strictly adhering to a diet for a long
Exactly.
time.
Like, yeah, exactly.
Because I
You
also
should.
tell patients, yeah, you have to enjoy food. Food has to be
Yes,
enjoyed,
exactly.
but don't overindulge.
Yeah, that's true.